Hi there, it's Justin Lubino with Senior Advisors. And we've created these videos in the past that walk you through picking the most cost-effective Medicare Part D prescription drug plan using a tool that's on the Medicare website. It's called the Medicare Plan Finder tool. And this tool gets updated over the years. There was a big update in 2019. And each year after, they've continued to make updates to the tool. So we just wanted to do a refresher video with the latest changes on the Medicare Plan Finder. So if you want to do this analysis on your own, this video will walk you through how you can look for the most cost-effective drug plan. So your first step, if you go to medicare.gov, the Medicare website, there's a button here that says Find Plans, Find Health and Drug Plans. So you're going to click that button. Then it's going to take you to this screen where if you have a mymedicare.gov account, which I recommend if you have a Medicare number and you're already on Medicare, you should create one because there's a lot of good information there. You can log into that account. And the advantage of doing that here is it will allow you to save your drug list. So you don't have to keep re-entering in the drug list year over year or every time you want to rerun this analysis. However, for the purpose of this example, we're just going to continue without logging in just to show you how the tool will work. So the first step asks us kind of what plans we want to look at. And for the purpose of this video, it's really about Part D prescription drug plans. You put in your zip code, which I'm just going to use our office here. And it asks if you get any extra help. And for this example, I don't get any extra help from Medicaid or anything like that. And you click Next. And then do you want to see drug costs when you compare plans? You select Yes and click Next. And here's where you enter in all your prescription information, okay? For the purpose of this example, we're going to use an individual that has 3 medications. And I'm going to show you when you start typing in the medications, the nice thing, it starts to fill in the list. So if you don't know the exact spelling of the medication, it'll kind of help you with the autofill there. This individual is taking Lipitor. And when you go to add the medication, another nice feature of the tool, it lets you know there's a generic available. Most people that are taking Lipitor are not taking the brand anymore. They're taking the generic. So this individual happens to be taking the generic, which is atorvastatin. So we're going to add the generic instead of the brand. If you proceed with the brand name, the majority of these Part D plans are not going to cover a brand name medication if there's a generic available. So it wouldn't be covered. You pay a lot of money for it. So we're going to go with the generic. And then you can select the dosage. This individual is taking 10 milligrams once per day. So that's 30 per month. And you hit Add to my drug list. Now it's in your drug list. Okay, that medication has been added. And we're going to add a couple other medications. There's a diabetes medication this individual is taking, metformin, add to drug list. And we'll just go with 500 milligrams and 60 per month, which is twice per day. So now we've added 2 drugs. We're going to add in one more drug, which is a kind of a heartburn medication, esomeprazole, which is a generic. We'll just go with the default dosage, which is 40 milligrams once per day, which again is 30 per month. So now you've got the drug list entered. You've added in your medications, and you click down here. There's Done Adding Drugs. And it's going to take us to the pharmacy selection. Okay, so for the pharmacy selection, each of these Part D plans has its own pharmacy network. So the drug costs are going to vary based upon the drug plan in combination with the pharmacy and the pharmacy network, whether it's in-network, out-of-network, if it's a preferred pharmacy or standard pharmacy. So, we're going to select, you can do up to 5 pharmacies, but mail order is one of those. So we're going to put in mail order pharmacy, and we're going to pick a couple of local pharmacies that are around here. And then we'll pick a Walgreens, a national one, and a CVS just to kind of see what this does with the report. You can also search on your name of your pharmacy if you don't see it in the list. You can look on the map to find the pharmacy, so you can find the pharmacy a few different ways. After you've entered the pharmacies, you click the Done button. And now the tool's doing all the work for us. It's looking at all 30, there's like 30 different Part D plans to choose from in each state. And it's looking at all 30 of those plans to figure out what the total overall cost is going to be for the rest of the year. So we happen to be running this report in August. So the rest of the year would be September through December. Okay, so we're only looking at 4 months just because this is the time of the year we're running this video. And the tool is looking at, for those 4 months, what is the total cost for each of these 30 plans? The premium plus the cost of the drugs and then it's sorting the list based upon that total cost. So we're not just looking at the premium, which is the monthly cost you pay for the plan, and we're not just looking at the co-pays for the drugs, we're looking at the total to find the lowest overall cost for the next 4 months of the year. So in this case, the one that comes up most cost effective, it's called Horizon Medicare Blue RX Saver. And this tool shows us the premium, which is $23.50 a month. This number right here is the most important number to determine the total cost for the year. So it's looking at that $23.50 a month plus the cost of my 3 drugs for the next 4 months. And if I go to the retail pharmacy, it's $134. That's the total number. If I go to mail order, if I order it through the mail, it's a little bit cheaper. So it's $10 less for the rest of the year. This plan also has a deductible of $150 for the higher tier drugs. So we're going to look at that a little bit further. But basically, this would be the most cost effective for this particular situation. If you go down through the list, you'll see the next one that comes up. It has a lower premium, $16.30 a month. Oh, that must be a lower cost. Well, no, it's actually slightly more, 4 cents. It's not a lot more, but in this example, because the drug costs are higher, that's why the tool does the work for us. It figures all that out and gets you that total number for the rest of the year. So even though you're saving a little bit on premium, you're going to pay more in drugs, which is overall going to cost you more. If you keep going through the list, you'll see 147 is the next one. Again, a lower premium, but the total cost is more. Another $24 a month plan, but the total is $170. Keep going, 172. Let's go all the way to the bottom of this first page. 245 would be the total cost. If we go down to the third, there's 3 pages because there's 30 different plans. There's 10 on each page. If we just go down to that third page to find the worst possible one, it happens to be another Blue Cross plan, and it has a higher premium, but the total cost for the rest of the year is significant because one of these drugs isn't even covered on this plan. So the purpose of this, you have to understand the premium is really not how you want to pick these Part D plans. You want to look at that total cost. Just because you're paying a higher premium doesn't mean you're getting a better drug plan. All right, it's very different than most other insurance where you think you pay more and you get more. These Part D plans, it's very specific to the medications that you're taking as far as which is going to be most cost effective. All right, so this is the plan, again, that came up most cost effective. There's a lot of great detail in here. If you hit plan details, you can see more information here. So you see the monthly premium, the total drug cost. If you go to the retail pharmacy for the rest of the year, if you go mail order, the total drug cost for the rest of the year is $30 versus $40. Then it gives you, again, the premium, the deductible, drug coverage information. So for each of the pharmacies, it'll tell you whether they're in network, out of network, standard, or preferred. This plan happens to have just standard pharmacies, no preferred pricing with this particular plan. But most of the plans have a standard network pharmacy and a preferred network pharmacy, so you would see that information here. And if you go to preferred pharmacies, it's lower copays than standard if they have preferred. Okay. Then it shows you for each of those medications at each of those pharmacies, what is the total cost for the year for the drugs. This drug happens to be a 0 copay. It's a tier 1 generic on this plan, which has 0 copays. So those are 0 costs for this drug. Same as the metformin. The only one that has a cost actually is this esomeprazole, which is $40 for the rest of the year if you go to a pharmacy, or $30 if you do mail order. Then it breaks it down, the total again. So this is that most important number. They put it right in the middle of the page, but on the first page it was there, which is really that number that we use to pick the plan. This is the total cost for the rest of the year, the premium plus the drugs. All right. Then it shows us when you're going to meet your deductible. This individual, there's only 4 months left in the year, is not going to meet that $150 deductible for their medications. If you look at a full year report, you may see, this is when you're going to meet the deductible. Then it breaks down by month. Again, this is a pretty simple example. If you had more expensive drugs, you might see some more fluctuation based upon when you meet the deductible and so forth. But for this example, you can see it's basically $10 a month for the drugs, except if you do mail order, it's $15 for 3 months supply. So that's where you get that little bit of savings with the mail order with this plan. And then it breaks it down even further by each of the pharmacies. You can see in this example, it's not really that pertinent because all the pharmacies have the same pricing. But if you had an example where there was a variation in pricing by pharmacy, preferred versus standard, you would be able to break that down further to see which, for each of these pharmacies, what's it going to cost me for my drugs and for each of them. So this one, you can see this first example is Bell's Pharmacy. The retail cost is the kind of the full cost of the drug with the plan, but the cost before deductible is what you're going to pay before you meet that deductible. So again, even though it has a deductible, you still have a zero copay for these tier 1 generics, and that one drug is $10 per month at this pharmacy. If you were to meet the deductible, it shows you the cost after deductible, which happens to be the same. And then there's cost in the coverage gap, which is also called the donut hole. And then after the coverage gap, which is also called catastrophic coverage. We have other videos out there that explain these different phases of Part D of Medicare. This individual is not going to come anywhere near the coverage gap, so it doesn't even come into play. But you can watch those other videos that explain those if you're interested. And then it just goes through for each of the pharmacies, so you can look at that breakdown. And then also for mail order pharmacy. Again, this is for 90-day supply. Mail order is 90 days, so it's still zero cost for those two drugs and $15 for 90-day supply of the esomeprazole. So, and then at the view more drug information. So if you want to see the different tiers, so these plans generally have a 5-tier pricing mechanism for the drugs. You can take a look to see how that would work. Candidly, we're not that concerned. We really want to know based upon your specific drugs you're taking right now, which the tool does all that work for us. We just went through all that, and it calculates all of that for us. So the unknown factor, what you might get prescribed, what tier it might be in, we don't pick a plan based upon that because we can't predict the future. We pick the most cost-effective plan based upon what we know right now. And then you can change these drug plans every year between October 15th and December 7th. So other drug information, it tells you for each of those drugs you're taking, what tiered they are on this plan, if there's prior authorization required or quantity limits for the drugs, and then if there's a step therapy, which means kind of have to work through other medications to get to that medication, which is for more expensive kind of brand name drugs. Then it just relists your drug list, so you have that information here with the quantity and everything that you entered. Down here, some people get concerned. They put this information about Part B drugs, which really just raises a lot of unnecessary concerns. So Part B drugs are drugs that are covered by Part B of Medicare, not Part D as in drugs. So Part B will be things that are administered in a doctor's office, a lot of injectables because the doctors are administering those, chemotherapy in a lot of cases is under Part B. So those are not going to be covered by Part D because they're covered by Part B. So you'll see that here, chemo is not covered because it's covered under, if you have Medicare Part B and a Medicare supplement, Medicare would pay the 80% and generally the supplement the other 20%. That's how that would work with the Part B drugs, right? And then there's star rating. So the government has a star rating system, so you can see the different ratings for each of these plans. I will tell you, in most states, there really aren't any 5-star plans. There are some in certain states, but for these Part D plans, there's a lot of 4 stars and 3, but we just don't really see any 5 stars. Very rare for the Part D drug plans. So it is a factor. We do look at it. We don't want to pick really a 2-star plan or even maybe a 3-star, depending on the situation. But it's unlikely you're going to find a 5-star in most states for the drug plans. And that's basically it. That's how we look at these Part D plans. Again, there's a lot of different examples. If you have more expensive drugs, it'll look a little bit differently. If you have a full year, which we'll be able to look at not until October when the 2022 plans come out, we'll be able to look at that. But for now, this gives you kind of a sneak peek on how to do the analysis and look for the most cost-effective drug plan. We hope you found this video helpful. If you want to get additional updates, you can subscribe to us on YouTube, follow us on Facebook at Senior Advisors. And we hope you found this helpful and hope you have a great day. Thank you.